Fruit and diabetes limits, guidelines, risks, and tips. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide. Risk factors for developing type 2 diabetes include being overweight and having high blood sugar levels. Although fruit does contain sugar, eating it as part of a balanced and healthful diet is unlikely to cause diabetes. Learn more here. Takeaway. Although there is no clear cause of type 2 diabetes, risk factors include being overweight, having a family history of diabetes, or having prediabetes. Fruit does contain sugar, but it is unlikely to be harmful to health as part of a balanced diet. In this article, we look at what diabetes is, whether eating too much fruit can cause it, and the medical guidelines for how much fruit to eat. Excess fruit and diabetes risk. Eating too much sugar can contribute to weight gain, which may lead to higher blood sugar levels and prediabetes. These are both risk factors for type 2 diabetes. Fruit contains many vitamins, minerals, and fiber, but they also have a high natural sugar content. However, this makes them great as a replacement for artificial sweeteners and table sugar as a supplement for sweetness. Generally, eating fruit as part of a healthful diet should not increase the risk of diabetes. A diet that is high in sugar, refined carbohydrates, and saturated fats is likely to be more of a risk. However, consuming more than the recommended daily allowance of fruit may add too much sugar to the diet. Choosing fresh fruit rather than dried fruit, and limiting the intake of fruit juice or smoothies can help reduce a person's overall sugar intake. What is diabetes? Diabetes causes a person's blood sugar, or glucose, levels to become too high. There are two main types of diabetes. Type 1 diabetes typically develops in childhood. A person with this type is unable to produce a hormone called insulin. It is usually not possible to prevent this form of diabetes. Type 2 diabetes is the most common form. It can occur at any age, but it usually develops later in life. In people with type 2 diabetes, the cells do not respond appropriately to insulin. Doctors call this insulin resistance. Insulin causes sugar to move from the bloodstream into the body's cells, which use it as an energy source. When a person eats, their digestive system breaks down carbohydrates into a simple sugar called glucose. If there is not enough insulin in the body, or the cells are not responding correctly to the insulin, sugar can accumulate in the bloodstream and lead to a range of symptoms and health complications. A person cannot always prevent type 2 diabetes, but often, making lifestyle and dietary changes can reduce the risk of developing this condition. Eating a healthful diet, maintaining a healthy weight, and getting regular exercise can reduce blood glucose levels and the risk of developing type 2 diabetes. Should people with diabetes eat less fruit? People who are overweight are more at risk of developing type 2 diabetes. One of the main causes of weight gain is eating more calories than a person burns off. Sugary foods and drinks are usually high in calories. Staying within the recommended allowance for fruit should not increase a person's risk for diabetes. Fruit juice is particularly high in sugar. Drinking no more than 1 cup of fruit juice per day can help keep sugar intake within healthful limits. Many processed or baked foods, such as biscuits and ketchup, contain added sugar. Eating less of these foods can help a person reduce their calorie and sugar intakes. People with prediabetes have blood glucose levels that are high, but not high enough for a diagnosis of type 2 diabetes. Having prediabetes does not mean that a person will definitely develop diabetes, but it does increase the risk. By lowering their blood glucose levels, a person with prediabetes may be able to prevent it from developing into type 2 diabetes. Losing weight and engaging in moderate daily exercise can help reduce the risk. Also, certain medications can reduce the risk of developing diabetes. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide.